What if someone told you that the chronic pain you're experiencing could be treated without the use of pain medications or surgery? That the injury site or aging joint could be rejuvenated, eliminating the pain by using something your body produces naturally? You'd probably think this is something not available today, something only future patients will benefit from. Well, the future is now. Stem cell therapy is a viable technique that is greatly improving the quality of life for patients who have chosen this innovative treatment option.
Stem cells are reparative cells. They're naturally found in your body in certain areas. With joints or arthritis or sports injuries, we can't utilize those stem cells to repair ourselves. And so there are several places in the body where stem cells are found in an abundant supply, such as the bone marrow, around the fat, or there's some in the bloodstream. So we can harvest them from this tissue and then refine them. It's sort of like drilling for oil. You get a raw product like crude, and then we take it to our lab, which is like the refinery, and then we make it into gasoline. We then take that refined product, which is a concentrated form of stem cells, and then we place it in the area that's injured. The use of your own stem cells is a non-surgical, minimally invasive procedure. It's a walk-in, walk-out, and I stress walk-in, walk-out. There's no downtime, there's no crutches, there's no pain pills.
Two of the most popular techniques, PRP injections and autologous transplantation, are used to treat a wide range of orthopedic conditions related to the knee, shoulder, hip, elbow, and ankle, just to name a few. A reputable physician will determine the right treatment protocol, but Dr. Locks warns patients to do their research when looking for a doctor.
There has been a little controversy over some people doing stem cell therapy and may not understand the full science. So I think it's very important to do your homework and find an expert in this field and has done it for a long period of time.
Well, I've been playing football since I was 7 years old, and it got to a point where I think I was 47, and I was having problems walking up the stairs at night. My knees were swelling up, and I just knew I had to do something. And it just so happened that somebody brought up stem cell therapy and heard about Dr. Locks. I looked into it a little bit and went through with it, and it's probably the best thing I've ever done for my body, because I went from my knees being like 90% in pain to 10% in pain in, it seemed like 2 weeks. So it really was amazing. And I teach a spin class once a week. I work out some young kids that are football players, and I'm bending as well as they are. So it's done a lot for me.
Been playing soccer since I was 4 years old, and then around 13 or 14 years old is when the pain started. It basically just felt like I sprained my ankle, simply just sprained my ankle. And then I remember the day that it happened, my ankle basically collapsed. I was not able to walk on it. I had to be carried to the car. I went to about probably 5 doctors, and they were all saying the same thing, that I needed ankle fusion surgery, and they were telling me to choose a whole different sport. But because they were telling me that I had avascular necrosis, and basically it just means dead bone, and my dad was doing research on it and found Dr. Locks, that he did stem cell and he worked with avascular necrosis. After 9 months, 10 months, then I started training again and started getting into soccer again. Very slowly, but I could actually play. I didn't have to give up soccer for the injury. I can continue playing the sport that I love.
With offices in Beverly Hills, California and Clearwater, Florida, Dr. Locks is a world-renowned stem cell expert. As a pioneer in the industry, he is one of the most sought-after physicians in regenerative medicine.
I understand the science behind this quite well. I'm a frequent lecturer around the world, and the audience is university professors and stem cell researchers. I've taken great pains to keep abreast of all the topics and know the ins and outs of this, which has helped me to answer just about any question that patients have for me. I've had Nobel Prize-winning authors, professional athletes from a variety of sports, but I also take care of the weekend warriors and patients who are afflicted with arthritis of their joints as they get older, and it's quite rewarding to treat such a variety of patients.
Thank God for Dr. Locks, because I don't know where I would have been, because I was starting to slow down. His therapy kind of sped me up a little bit, and I still feel great. I'm going to turn 50 this year, and I'm still working out 6 times a week, so I'm good.
To learn more about regenerative medicine or to schedule an appointment with Dr. Locks, visit drlocks.com.